हेलो। am I audible, sir?
Yes, sir, you are audible.
Hello.
Very good evening, sir. You are audible.
Hello.
Hello, hello,
Hello.
hello. Yes, sir.
Audible, sir?
Yes, sir. You are audible, sir.
Okay, okay, okay. Yeah, thank you.
Good evening, sir.
Yeah, good evening.
Good evening, sir.
Yeah.
Another 2 minutes, we will start.
Sure. Sir.
Very good evening, one and all. Today, we are having a very important subject, how to handle medical legal issues in the emergency room. Treating patient is very important, but at the same time, saving our skin is also equally important. So today we have an excellent speaker, Dr. Saravanan. He is a qualified emergency physician and a medical legal expert. He is a head of the department and a senior consultant in Meenakshi Hospital, Madurai. Sorry, Tanjavur. Is Meenakshi Hospital in Tanjavur. Has a very vast experience and a very excellent speaker. Now he is going to give a brief overview how to save ourselves from the medical legal issue. Any questions, just put in a chat box. Dr. Saravanan will answer all your doubts. Saravanan, you can take over.
Sure. Thank you, sir. Is the screen visible, sir?
Visible, yeah? Please proceed.
Sure, sir. Good evening, all. First of all, I would like to thank Dr. Sendil Kumaran, sir, and Association of Physicians of India for giving me this opportunity to talk in front of this elite crowd. So the topic is Code Blue to Courtroom, how to stay safe legally in the ER. So immediately we'll move on to the topic. Basically, a doctor should know at least these 8 laws and acts. First one is a criminal penal code. This defines what is a crime. Then we should have a little idea about the IPC, now renamed as BNS, that is Bharatiya Nyaya Sanhita. This defines the punishment for the crime. And third one is Indian Evidence Act. It defines what are the evidence that can be submitted in front of the court, including a material evidence or maybe a human being. And fourth one is our National Medical Council Act, which defines the medical ethics and etiquettes which a doctor should follow when he is treating a patient. And fourth one is POCSO, mainly for preventing pediatric sexual offenses. Then Clinical Establishment Act, where the government has given the guidelines which should be followed or protocols which should be followed while treating any patient. So this is being now submitted in the court as a reference, whether the doctor follows the proper guidelines. Then there's a Consumer Protection Act. So everybody will be aware of that. Then finally PCPND Act. So these are the common acts or laws every doctor should know. It's a basic requirement. So we will know, we'll see the importance in the next few slides. We'll move on based on some scenarios. Today I'm going to discuss about 10 scenarios which really happened and how we have to save ourselves. That we will be seeing in the further sequence, subsequent slides. First one is medical legal duties of a doctor in a suspected or actual poisoning. Commonly, as a physician, we are regularly seeing a lot of patients presenting with poisoning to our emergency department. Actually, in accidental or suicidal poisoning, there is no legal obligation to notify the police. Sometimes patient may be coming and asking us, sir, we are from a reputed family, so we don't want to go to the court. So please don't give police intimation. So if you are telling that it's a mandatory, then they will say that, okay, then we will leave the hospital, we will go some other hospital. So in that case, there is no legal obligation when the patient commits a suicide by accident or it's really a suicide as a matter of dying. So according to our Indian Constitution, previously suicide was an offense. Till 2 years back, our Constitution says that there are 6 fundamental rights. The right says that right to live, but there is no right to die. So according to the Constitution, if anybody commits suicidal attempt, it's an offense. But in 2011, a Supreme Court gave a verdict for a patient who committed suicide. So he is committing suicide because of lot of problems he's having. Maybe a love failure or maybe some financial loss, something like that. So already he's suffering a lot. Then why we need to punish? So the Supreme Court has given a verdict, suicide is not an offense. So since then, a lot of judgments has come that suicide is not offense. But thing is, if the patient dies, the police has to be informed. This is very important. And death certificate must not be given without a postmortem. So they need to find what is the cause of the death. And if they found that there is a homicidal attempt or somebody is forcing the patient to commit suicide. For example, the mother-in-law may be forcing the daughter-in-law, or somebody might be holding the particular employee. So in that case, somebody is forcing the particular person to commit suicide, then it can be a homicidal that we don't know. So all cases of homicidal poisoning, it can be a definite or suspected, must be compulsorily reported to the police as per the section 39 of the Criminal Penal Code. So if it is suicidal poisoning or suicidal attempt, then it's not mandatory to inform the police if the patient survives. Or if it's a definitely you are sure that or you are suspecting that there may be a homicide involved, then definitely it should be informed to the police. So failure to inform the police will make the doctor culpable under the BNS, and simple imprisonment for 1 month or fine or both may be implemented for the doctor. If the police require information on any case of poisoning, which is either suicidal or homicidal in nature, the attending doctor has to be divulging it. So there is no privacy. So actually we want to maintain the privacy and secrecy of the patient documents. But if it's a case of poisoning or suicidal or homicidal attempt, we need not get consent from the patient to divulge his personal details or the treatment details. So there is no scope for professional secrecy in such homicidal or poisoning matters. It is according to the section 175 Criminal Penal Code. If information is withheld, if the doctor is not revealing it to the police, then he may be given a punishment for 6 months imprisonment or fine or both. If the poor doctor is giving wrong information, then according to the Bharati Nyaya Sanhita, he may be given a punishment for 7 years with a fine. So every effort must be made by the attending doctor to collect and preserve the evidence suggestive of poisoning. So any deliberate omission, which again amounts to a fine of punishment of 7 years or fine. Coming to the scenario 2. So whenever we want to take a dying declaration, so most probably we will be taking a dying declaration when the patient is a female patient married less than 7 years and commits suicide or maybe a burns or something like that, when the patient is getting admitted, so we may be have a duty to inform the magistrate. So that time the patient should be conscious. We cannot ask the judge to come to take the declaration when the patient is unconscious or on the ventilator. So patient should be conscious and oriented, and there is a possibility for death. These are the two indications. So we have the doctor is bound to the duty of giving information to the magistrate. How to call the magistrate? So first we have to give a police intimation. So we have to give a letter to the police, the nearby police station, saying that the patient is consumed some red color paste, something like that. The patient is now conscious and oriented, and she may deteriorate within another next 24 to 48 hours. So we may have the obligation to take a dying declaration. Like that, we have to give a intimation to the police. The police will bring the magistrate. So this is the procedure. So if the death appears imminent and delay in arrival of the magistrate may if there may be delay in the magistrate arrival, then the doctor is again, he can himself record the declaration with a video documentation. So this is mentioned in the section 32, clause 1 of the Indian Evidence Act. So without the patient is all right, then the doctor has to wait till the magistrate arrival. And scenario number 3, this is very, very interesting. That's a very famous case called Anuradha Saha case or Gunal Saha case. So Anuradha Saha is a female psychologist, child psychologist. She's an Indian who settled in US. She came back to his native place, Kolkata. So there she died due to some vasculitis and skin problem. In that case, the court has awarded 11 crores. So this is the highest compensation ever awarded in the Indian history of judicial system. So that's the highest punishment or highest the compensation awarded. This case was filed by her husband, Dr. Kunal Saga. He himself was a doctor. Both were settled in US, and they came. This is a couple. Actually, this Dr. Kunal Saha and Anuradha Saha. She's a 36-year-old child psychologist. He was coming back to her native place in Calcutta, where she developed a severe body pain, fever with rashes. So she went on a nearby clinic on 7th of May 1998. The doctor saw the patient and suspected some allergic reaction. He gave an injection of depometral. So we will all be knowing that depometral is a sustained release steroid preparation. So, but the doctor, he recommended this preparation twice daily for the subsequent 3 days. Actually, this drug is advised to give once in a week or once in 2 weeks. But the particular doctor gave the medicine, this particular steroid, twice daily for 3 days. That 80 milligram of depometral. Even after 3 days, there was no improvement. There was worsening of the condition. Since she was taken to another multi-specialty hospital in Kolkata on 11th May. Actually, just I will tell the reason for which the particular incident which happened in the hospital later in 2011. That too, after some 13 years, the same hospital, it was shut down on the grounds of negligence in 2011 after 13 years. This is not related to this particular death of the doctor, but the hospital got a fire, and almost 93 people died. Mostly the patients as well as nurses, they died in 2011. So this was taken in mind when the judgment was given by the court in 2012. So coming back to our case, at XYZ hospital, the Anuradha Saha was admitted. Again, as they were starting on steroid, that is prednisolone, with a tapering dosage. But the primary doctor, Dr. X, we let him, don't want to reveal his name. So the Dr. X is a primary physician. He already had commitment to go to US. Hence, he admitted the patient. The next day, he left to US. That time, he handed over the patient to a dermatologist and another physician. He gave the diagnosis of allergic vasculitis and again continued steroids. By 12th May, the next day, the dermatologist have the right diagnosis. She was diagnosed to have toxic epidermal necrolysis, that's a 10. Again, the treatment was continued since there was a dermatological emergency. The steroid was continued without any much changes. Since the patient was gradually deteriorating, again the patient was shifted to Breach Candy Hospital in Mumbai. she was airlifted from Kolkata to Mumbai. Again, she continued treatment for nearly some 2 weeks there. And finally, the patient died on 28th May. So almost she took treatment for 21 days in the 3 hospitals, a small clinic, then followed by a multi-specialty hospital in Calcutta, then airlifted to a Breach Candy Hospital in Mumbai. And finally, she died on 28 May 1998. So after her death, Gunal Saga approached West Bengal Medical Council and Kolkata High Court for compensation. But both cases he failed, and they dismissed the case against the XYZ hospital. In March 1999, after almost 10 months, he issued a legal notice to as many as 26 people who treated the patient and the hospital, alleging that there was a negligence in the treatment. So directly you moved on to National Consumer Dispute Redressal Commission. That's a National Consumer Forum, where he was awarded almost 1.7 crores. They found that the hospital and doctors were guilty of prescribing a wrong dosage of medication, but he was not convinced. So again, in 2009, he moved to Supreme Court, claiming that the compensation amount was not adequate, and he wanted to have the justice with the compensation of 200 crores. He issued the almost 26 people. He asked for 200 crores compensation. The court documents now states that while handing over the patient, that Supreme Court is mentioning that while handing over the patient to the particular Dr. X, while handing over to the dermatologist and another physician, most culpably, he did not even prescribe intravenous fluid and adequate nutritional support, which was mandatory in that particular condition. So he gave all the treatment, but it was not simply documented in the case sheet. That's a very simple mistake. So this was very much observed by the Supreme Court. Then finally, it gave the verdict that the patient has to be paid almost 11 crores. So this is a landmark judgment. So why they advise they are granted 11 crores? The reason is usually whenever death occurs going for a compensation, the compensation will be calculated based on the net annual income. So how much the patient is earning per month multiplied by 12, that gives the net annual income. That factor will be multiplied by 10 to 18 years. That's the maximum compensation awarded till 2012 before this judgment. But in this particular case, the Supreme Court considered the annual net income should be multiplied by 30 years. So the particular Dr. Anuradha Saga was 36 years old. When she died, she was expected to live for another 30 years. That means she can live up to 66 years. So due to their premature death, the amount which she will be earning will be lost. So considering that 30 years, they gave the compensation of around 5.6 crores. After that, still the court went further. They made the judgment based on the inflation adjusted compensation. So they told that, so since the verdict was coming after nearly 14 or 15 years, there is a time consuming judicial process. So this leads to, there is a depreciation in the money value. The person claims at least 10 lakhs as a compensation, for example. So which is decided 15 years later, even if the entire claim is awarded, the patient, the particular person, he may not be get the enough amount. So that value of 10 lakh will be reduced after 15 years. So Supreme Court considered that the compensation should be calculated based on the inflation. So now they have coming with the concept of giving interest, again adding interest to the particular fine. So they gave the fine was actually 5.6 crores. With the interest, it mounts up to 11 crores. So for 14 years. But he also filed a criminal as well as civil case against the doctor in the hospital. But in 2009, the Supreme Court declared that the doctors were not liable for the criminal cases, but civil case can be continued. But yet the verdict is a strong warning for the medical community. So after that, so many judgments were given, which were given in lakhs and crores. So this is the first landmark judgment where the Supreme Court awarded almost 11 crores. The inference is documentation is very important and crucial. So whenever the doctor is leaving the hospital or whenever you are going out of station, something like that, so proper handing over should be given. All the treatment which is given should be documented in the case sheet. If it is not documented, then it is not done. This is the court's verdict. So a lot of doctors nowadays, instead of treating patients, they are treating the case sheets. So this is the problem now, but we have no other go. We have to abide by the court's direction. And second one, try to avoid any block mark or bad name at any cost. For example, this case, before the verdict, the hospital got a fire and 93 people died. So the court is thinking that the hospital is having no proper safety measures in the hospital. That's why it's not able to prevent a fire and it killed 93 people. Same thing applies to this particular patient also. The article must have, the hospital might be not giving adequate care and negligent, and not safety measures are followed, including the patient drug dosage or treatment. That's why the patient died. So this was the impression to the court. So better to avoid any block mark or any cases putting on us. So better we should have proper documentation. Then we should get rid of the case as early as possible. So if a case is against us and if you are paying fine or compensation, then it will be kept in mind when subsequent punishments are given or for subsequent cases are filed. Then coming to scenario number 4, again this is another interesting case which is recently, almost last year, came in Tamil Nadu. The verdict was given in the last year. So 40 years old man, he suffered a road traffic accident. He was admitted in a government medical college where he was diagnosed as having a left humerus fracture. Then he was attended by an orthopedician in the government medical college and he was referred to a private hospital where he wanted to operate. So in the private hospital, no doctors were available. So the patient was received by a nurse and the nurse informed to the hospital owner. He was the physician. He's a general physician. So since there was no duty doctor, the doctor as a nurse informed that hospital owner that the patient has been referred by the orthopedician and we have received the patient. The physician now gave the order that, okay, you put a line and start on injection taxing 1 gram IV twice daily. The message he was sending through the WhatsApp. The patient, after giving the injection, suddenly collapsed and died. We don't know the reason, exact reason. Till now, we don't know. The relatives sued the particular doctor and the hospital in the court, claiming that the death is due to wrong medication because the patient died only after the medication. So they are telling that the patient is died because of the wrong medication and there was no doctor available. But the hospital management, they defended that the death is due to pulmonary embolism. So sudden death was due to pulmonary embolism due to the long bone fracture and not due to any negligence. But the District Consumer Forum found the doctor and the hospital was guilty and the judgment came last year, as already I told you. They awarded the compensation of total 91 lakhs. The doctor who referred, the orthopedician was fined 5 lakhs. The hospital owner, the particular physician was fined 15 lakhs. And the hospital administration or the management as a whole, they was fined 71 lakhs. So totally the compensation award was 91 lakhs by the District Consumer Forum. The problem is the same hospital was again fined 15 lakhs for another negligence case few months back. So again, already I told you, there is a block mark on your hospital on your name. So this will be considered in subsequent cases. So a few months back only, they were fined 15 lakhs. Again, they went for appeal. The verdict was not yet arrived. But still, as per the District Consumer Forum, the particular hospital was found guilty and negligent. So within another 3 months, this case came. So ultimately, they found that the hospital, they will have that remark. So if something goes wrong, everything will be wrong, like that. So the hospital was fined 91 lakhs. So again, for the second case also, now they are appealing for the State Consumer Forum. But still, they have to deposit at least 50% of the compensation. So that means nearly 45.5 lakhs they have to deposit in the State Consumer Forum for appeal. So considering the previous case, they have to pay 7.5 lakhs. And for this particular case, they have to pay another 45 lakhs since their compensation 91 lakhs. So totally for the 2 cases, so almost more than 1 crore, they have to deposit nearly 50 lakhs in the State Consumer Forum for the appeal. They are not depositing this amount, they cannot go for appeal. So in the district court itself, we should able to win the case, or we should have a proper documentation. So medication was prescribed without examining the patient. This is the main observation by the court. So the doctor gave the order through the phone. He never saw the patient. He never saw what's the problem, what's the diagnosis. So nurse was telling there is a fracture. So he is trusting the staff nurse and he started giving the medications. So the court observed that the doctor has never examined the patient. This is the main problem. So that's why they awarded with some almost 91 lakhs. and no doctor available to manage the patient when the patient developed cardiac arrest. So this also was considered. So considering these two issues, the particular patient was awarded 91 lakhs. So why consumer cases are increasing nowadays? No deposit required, unlike civil cases. So usually for filing a case under civil court, minimum 10,000 should be filed, should be deposited in the court by the patient. But in consumer forum, there is no deposit amount required. Just simply they can go and file the case. And second one, so public realizes that criminal cases will not solve their financial issue. So they don't want to put the doctor behind the bars. So they want to put the doctor behind the bars. There is no use for them. Maybe the doctor will be suffering, but there is no financial benefit or monetary benefit for the patient who lost patient family who lost the family head. So for these two reasons, they are putting lot of cases under consumer forum rather than in criminal or civil cases. Moreover, the common sense has been increased since 2019. There is amendment in the Consumer Protection Act 2019, where they have mentioned that the patient maybe died in Chennai or somewhere, but they can put the case in their local residing district itself, maybe in Tanjavur or in Kadalur district, wherever the patient is residing, there they can file the case. So up to 1 crore compensation, they can file the case in the district forum. If they want more than 1 crore, but less than 10 crores, then they need to directly go to the state forum. So district forum, every district will be having that district for consumer forum will be there. State forum will be only in the state headquarters in Chennai. For example, in Tamil Nadu, it will be in Chennai. So if they want more than 1 crore or less than 10 crores, then they can directly go to Chennai. Then only they can file the case. If they want more than 10 crores compensation, then directly they have to go to Delhi, where National Consumer Forum is there. So up to 1 crore, so a lot of cases are being filed in the district forum nowadays. So coming to the scenario number 5. So this is the first medical negligence case which was awarded in our India. The case was Indian Medical Association versus VP Shanta. That's a very famous case. Just I will elaborate what happened. So this is a landmark judgment which brought the medical specialty under Consumer Protection Act. Before 1995, medical specialty was not under Consumer Protection Act, but after 1995, after this case, our medical profession also now included in the Consumer Protection Act. So the VP Shanta is a 44 years old female. She went to a gynecologist for excessive bleeding PV. She's an unmarried lady, but marriage was fixed that time. Recently, that is in around 1995, the marriage was fixed. She was diagnosed with dysfunctional uterine bleeding. Now that's a AUB in the particular hospital, and she was advised for dilatation curettage. Hence, she was admitted for the treatment. During the procedure, there was uncontrolled bleeding. Hence, the gynecologist informed her mother for as a life-saving measure, got consent, and hysterectomy was done to save her life. So after hysterectomy, the patient survived. But since the patient's uterus was removed, then she is not able to bear the child, hence the marriage was cancelled. The patient now sued the doctor, since the doctor did not inform her about the hysterectomy. Actually, the procedure DNC was done under spinal anesthesia. This patient is fully conscious and oriented throughout the surgery, but this patient was not informed about the change in the treatment. Actually, the mother only gave the consent, and the doctor thought that actually the lady is age 44. She might have completed the family. So doing hysterectomy will not harm her. So that was the thought of the doctor, but the doctor didn't forget that this is unmarried lady. And soon after some months, she's going to get married. The doctor forget and he operated on the particular patient. But ultimately, the patient survived, but the marriage was cancelled. But the lady sued the doctor. The inference is, do not presume that patient's social background. So patient may be like, this is an unusual case, very rare case, but there is a possibility. Though even after 44 years or 45 years, still the patient is unmarried, and there is a possibility of get married after 45 years. So when the patient is fully conscious and oriented, so better to get the consent from the particular patient. So patient should be the first one to get to give the consent. Only when the patient is under the influence of alcohol, or if the patient is mentally retarded, or patient is having some unconscious state, head injury, something like that, then we can get a very morbidly ill, having cardiogenic shock or on ventilator, something like that. Then better to get a consent from the relative whenever any intervention is going on. But otherwise, better to get the consent from the patient. He or she is the most valuable person who can give the consent. So better get the consent directly from the patient, okay, rather than from the relatives. Then what are the precautions we have to take when we want to issue the medical certificate? 2 months back, a psychiatrist issued a medical certificate with the heading that to whomsoever it may concern. The certificate detailed the patient's medical condition as requested by the husband that who claimed it was needed for seeking a second opinion. He is asking the certificate for getting a second opinion, but he misused it. He went to the family court and applied for the divorce, telling that her wife is having some mental problem, so he cannot live with that lunatic. Then the wife again filed the case against the doctor. So every time the doctor will be the soft corner being targeted. Though the husband is cheated the doctor and got a false certificate, but the doctor is being sued in the court, being for breaching the patient privacy, and the court criticized the doctor, but not penalized or fined. But the court condemned the doctor for carelessly issuing a medical certificate without mentioning its purpose. So, how to avoid medical litigation when you are issuing as a medical certificate? Avoid generic headings like to whomsoever it may concern. Instead, you address the certificate with a specific individual, maybe particular doctor or particular institution or organization like that. So if you are giving a certificate for a student, you address the name of the school or the headmaster like that. So instead, don't give to whomsoever it may concern, and clearly state the purpose. So always mention why certificate is being issued. That is, this certificate is issued for submission to the particular institution or particular school or particular working place, office, something like that. Or the certificate is issued for seeking for a second opinion, and it is issued based on the patient's request or patient's husband request for the purpose of what the purpose they are mentioning. This ensures that the certificate cannot be used for any other purpose. And by following these steps, we can be following our ethical practices, what the NMC gives. The National Medical Council is giving a lot of 8 chapters are there. So we have to follow the medical ethics. So by doing so, we can follow the medical ethics and we can avoid litigations. There are 4 forms we should understand. This is form number 1. That's a physical fitness certificate. Better to have this type of printed certificate. These all things are available in our internet. Form 1, 2, 3, and 4. So I will little bit elaborate one by one. This is a government recommended form for giving a medical fitness certificate. So this is a form for a medical certificate. Or these 2 certificates, if it is not available, then you can give it in the letter pad, but don't give it as in the name of to whomsoever it may concern or in the blank form. So this is a form number 3. So this form is filled when there's a stillbirth. So baby is dying inside the uterus. You can fill up this form. So I'm not going to elaborate this one. So form 1A, both for physical fitness and medical certificate. For death certificate, there are 2 forms. Form 4, another one is Form 4A, and Form 2 is there. So Form 2 and Form 4 are issuing a death certificate for alive, or sorry, who are born alive and died after some time, till any age. So these 2 forms can be given. This is a judgment, or doctors were again punished by our medical council, Tamil Nadu Medical Council, for issuing a death certificate for the patients whom they didn't treat. These 2 doctors actually gave the certificate. They actually didn't attend, but the relatives were known to the doctors, it seems. So went and asked the doctor for cremation purpose. So in the cremation ground, they are asking for a doctor certificate, the death certificate. So for the purpose of cremation grounds, please give a certificate. They also issued. Whether they charged money or not, we don't know. But they gave money. Sorry, they gave the certificate. These were again found. The complaint was made by the local municipal corporation to the Tamil Nadu Medical Council, and these 2 doctors were given warning, and a 10,000 fine was implemented on them. So regarding the advisory for issuing a death certificate, don't give a death certificate if you have not attended the patient within the 14 days of his death. So and the second one is the doctor who treated the minor illness should not issue a certificate. Maybe if a patient died in even within 14 days, we might have attended the patient for some fever or some body pain, something like that. So fever or body pain will not cause death. So these are minor illness, but this doctor cannot give a death certificate for the particular patient. But you have attended the patient for is coming to your OPD. You may be maybe your follow-up patient. You may be having a chronic kidney disease, or you may be suffering from cardiac failure, or some treatment, some life-threatening illness will be there. You will be treating the patient. In this, the patient is dying within 14 days of your final consultation. Then you may you can give a death certificate, provided you are sure that the patient has not having any foul play in the death. So do not issue for cremation purpose unless it's clearly mentioned in the guidelines. Do not issue for cremation purpose unless the cause of death is clear. And finally, you should have a Xerox copy documented or preserved whenever you are giving a death certificate to the patient. So this is form number 4. This is actually, this should not be called as a medical, death certificate. This is called as MCCD, Medical Certificate of Cause of Death. So what we are giving is only a simple medical certificate. So no doctor is issuing a death certificate. The death certificate will be issued only by the forensic medicine specialist. Only after post-mortem, they will be issuing the death certificate, or it will be issued by the municipal corporation. So doctors, what we are issuing is simply a medical certificate for the cause of death. That's all. So the patient, or even we are ourselves calling it as a death certificate, that this is not a real death certificate. So how to fill this MCCD or the medical certificate? There will be 3 portions in this. So I'm talking about this form 4. That's a patient died in the hospital or institutional death. For institutional death only, this form 4 should be given. So it has 3 columns. One is immediate cause. Then second column, other significant conditions contributing to the death. And third one is any predisposing factors that may be related to the death, but not directly to the cause of death. For example, a patient who may be a chronic diabetic, he may be suffering acute myocardial infarction, followed by you may be developing a acute pulmonary edema and cardiogenic shock. So how to fill this form? So first, as an immediate cause, that should be a cardiogenic shock or acute pulmonary edema. So it's a consequence of acute myocardial infarction. And third one is that's a chronic diabetes. Like that, we have to fill in the 3 columns. So this is what we need to fill. And this one, next one is when a patient is coming broad dead. So this is a regular problem you might be encountering whenever you are in a large multi-specialty hospital. When the patient is broad dead, they will be asking for again this MCCD or death certificate. So whether we can give it or not. So these are 4 conditions we are encountering a patient brought dead to the hospital. One is our regular follow-up patient. He might be a patient with chronic kidney disease. So he'll be under our care for the past some 2 years or 3 years. We know the patient very well. He'll be having multiple comorbidities, having a severe LV dysfunction, ejection fraction of some 20%. He might have admitted some once in 2 months or 3 months for acute pulmonary edema. So he might be having some sepsis or something like that. So recurrently is coming and going to the hospital. We'll be knowing that the patient is having a lot of problems. So sometimes the patient will be again developing breathing difficulty at home. So with the pulmonary edema, they will be bringing to the hospital. On the way, patient might be dying. So if you are 100% sure there is no foul play and the cause of death is genuine, then you can give the medical certificate. But here you cannot give the form 4, which I mentioned in the previous slide. Here you have to fill the form 4A. That is the domiciliary death or non-institutional death. It is not regarded as a MLC. Since you know the patient and you are convinced that the patient does not have any foul play or any forgery done. So in that case, you are convinced, then you can fill the form 4A. Sometimes the patient might be referred from some hospital. You are in a tertiary care hospital. The patient may be referred from a small village or town. They might have diagnosed the patient patient have acute myocardial infarction, something like that. On the way, the patient might have died. So in that case also, you need not put MLC and inform the police. So, but don't give the death certificate since you have not treated the patient. So direct the patient or patient relatives to the referral hospital which have referred the patient to you. So since they have treated, they can give the death certificate since they know the diagnosis. So this patient also need not record as a MLC. A third case, so they are directly coming from the home. You have not seen the patient. It's not your follow-up patient. There is no referral letter, anything like that. And the patient directly coming from the home. Maybe it's telling that my father developed sudden chest pain and or breathing difficulty, something like that. So on the way, the patient might have died. But this case, again, you don't know the exact cause of the death. So you have to put MLC and inform the police. And you need not give any death, medical certificate for death. And fourth one is MLC patient. Patient brought death with hanging, or patient brought death with poisoning, or patient brought death with some accident, road traffic accident, or polytrauma. So it's a direct MLC case. So no need to give any death certificate. So just inform the police and send the patient to postmortem. So first two conditions, if it's a regular follow-up patient and there is a death is genuine, if you are convinced, then you can give the death certificate filling the form 4A. And the patient is referred from some hospital, don't inform the police. So inform the relatives to get the medical certificate of death from the hospital which referred the patient to it, but you need not have the obligation to give the certificate. And other two cases directly coming from home or no referral letter, or if it's an obvious MLC case, directly inform the police. So this is form 4A. So or the death certificate form for non-institutional domiciliary death. Almost the contents are same. Only thing, if the patient is not dying in the hospital, this form should be filled up and you have attended the patient within 14 days of death. Then only the doctor is eligible to fill this form. And this is the direction from the Department of Public Health and Preventive Medicine from Tamil Nadu. So whenever the patient brought dead, maybe in the third case, directly from the home, so the doctor is not having the compulsion to give the certificate for the cremation purpose. So what they can do, you can help the patient relatives, just fill this form 2. So already I told you form 1 for fitness certificate and 1A for medical certificate. Form 3 for stillbirth. Form 4 for institutional death or hospital death. Form 4A is for domiciliary death and form 2 for death reporting. So this is again all these forms are available in the internet. This form 2 can be filled directly by the patient relatives, telling all the details, whatever have been asked, patient name, address, and father name. So they need not fill the cause of death. Instead, they can attach the patient's previous discharge summary or medications which the patient is taking for the past few years. This form 2 along with the patient discharge summary and the medications prescription list should be submitted to the birth and death register directly. So if they are convinced, they directly issue the death certificate. And for the cremation purpose also, they will help them to do all the rituals. But if they are not convinced, they will inform the police. So the doctor is no way involved in giving the certificate whenever the doctor doesn't know the cause of death. So how much the patient is paying or how much the patient is requesting or begging you. So never give a death certificate or a medical certificate of causation of death if you have not attended the patient within 14 days of his death. Okay, coming to the scenario number 7, patient died during transport. So you may be shifting the patient from your hospital to another hospital. So the patient died during transport, during the ambulance transit. So what to do? Who's eligible or who is responsible for giving the death certificate? So according to the Birth and Death Registry Act, that is in the section 6 of the 6 says that any birth or death in a vehicle or during the transport, in respect of a birth or death in a moving vehicle, the person in charge of the vehicle, maybe the ambulance driver or maybe the paramedics or technician, they shall give or cause to be given to the information under subsection 1 of section 8 at the first place of halt. So wherever they are landing, they are prone to inform the particular hospital or particular place where they are landing or where you are halting the vehicle. So the expression given is, for the purpose of this rule, the term vehicle means conveyance of any kind used on land or air, that means flight or in the ship, and includes an aircraft, boat, ship, railway carriage, motor car or motorcycle, car, donga, and rickshaw. So wherever the patient is dying on the transit, so they have to inform or report wherever they are halting the vehicle in the first place. Okay, coming to the scenario number 8, role of NABH and Clinical Establishment Act. So a lot of people, lot of conferences I have seen that, even in quality forums, few are against the NABH guidelines are applying for NABH because there are a lot of rules and regulations. We are spending a lot of time in documentation and we don't have enough time to spend towards the patient care. And other things they are telling that due to NABH, so the cost of treatment increases. They are doing a lot of maybe, for example, they are advising to use the equipment once. And since the patient will be autoclaving and using the equipment sometimes, so that will bring down the cost. But they say that this equipment should be used only once, something like that. So in that case, the cost of treatment also increases. So few people are against getting NABH. But so definitely following NABH guidelines or norms or guidelines whichever the government is prescribed in Clinical Establishment Act or protocols, whichever mentioned, that should be followed. So this is a classical example. A patient is a 60+ patient. He was admitted with chest pains happened in Mumbai in the early morning 2 a.m. And he was diagnosed to have acute myocardial infarction. He was admitted in the tertiary care hospital, very famous hospital. Since it was late presentation, he crossed the window period more than 6 hours. The doctor who attended he refused to thrombolize, but he informed the cardiologist in the midnight, saying that the patient came with acute myocardial infarction and the patient is having ongoing ischemia and ongoing pain is there. But the cardiologist, he told that, okay, we can proceed with the angiogram in the morning. You just give some painkiller and stabilize the patient in ICU. So the patient was shifted to ICU and given some opioid painkillers. Then the angioplasty was carried out at morning 8 a.m. But the patient developed irreversible damage and developed cardiogenic shock and died later after 1 or 2 years, 1 or 2 days, sorry. So again, the patient son sued the doctor and the hospital in the court, and both were found guilty and both were penalized, saying that there is a delay in the treatment. The patient admitted at 2 a.m., but the treatment was carried out only, the definite treatment given only after 6 hours. So adhere to the international guidelines and document it. This is the only thing we can it's a legal defense for us. So if you are following the international guidelines, even if the patient dies, then the doctor or the hospital is not found guilty. So now the 6th edition of NABH has come. So there are some quality indicators already. There were some 18 quality indicators they are saying. Now they are coming with another 18 quality indicators. In that, they have given these 4 indicators as special mention with special mention. One is door to needle time should be monitored for a patient who is presenting with acute myocardial infarction and a patient who is presenting with stroke. So the stroke thrombolysis time should be monitored and MI thrombolysis time also should be monitored and it should be audited periodically. And if there is any deviation in that, for example, for MI, we should thrombolyze within 30 minutes of patient arrival. And for stroke, that's a 4.5 hours of window period since the time of stroke onset. If the time exceeds more than that, the team has to audit what is the reason for exceeding the recommended international time. Then they have to rectify it. That's a recommendation by the NABH. And again, they are advising us to monitor the door to balloon time. The patient is subjected to angioplasty. The plasty should be done within 90 minutes of patient arrival to the hospital. And the surviving sepsis guideline, it says that the sepsis bundle. So you have to take blood sample for serum lactate or the culture and giving antibiotic within first hour. All those things should be followed within 1 hour. Again, this should be followed, and if any deviation should be audited. So if you are following this NABH guidelines or this Clinical Establishment Act guidelines, then we are safe and should be documented in the case sheet. Then against the legal defense whenever the patient is having a complication or death. And coming to the scenario number 9, it's a contributory negligence. Again, it's a legal defense for the doctor. So there are 2 cases. One is Devender Singh versus Dr. XYZ. The patient advised to use the antibiotic mitomycin C for 2 weeks after pterygium surgery, operated on the eye. They missed the follow-up. Actually, he was advised to come back after some 2 weeks, but they didn't come back. But they continuously used the medication. The complication arises, but they didn't report to the hospital. After that, he lost the vision. Hence, he sued the doctor in the hospital, saying that they didn't give any proper instruction. But they are asking for 10 lakhs compensation. But the doctor was given the case sheet mentioning that the mitomycin C should be used for 2 weeks, and he has to report the hospital if any complication or maybe burning sensation in the eye or redness or so. This warning signs properly documented. He had given the advice to the patient, but they didn't remember that, and they didn't come back to the hospital. But this is negligence from the side of the patient. The doctor has given followed his duties, his responsibilities adequately, and he had given proper advice to the patient, but the patient didn't follow the advice. Hence, he lost vision. So this is the negligence from the side of the patient. Hence, though they asked for 10 lakhs compensation, it was not granted and the case was dismissed. And second one is Dr. ABC versus E.V. Thomas. Here, the patient had a knee injury. So particular hospital, they were not able to manage the particular ligament injury. Hence, they advised the patient to shift to a better equipped tertiary care hospital. But the patient, because of the financial restraint, we don't know, he didn't went to the hospital immediately. But he delayed the treatment by 10 days, which worsened the condition. The ligament injury was worsened. He moved on with the injured knee. So they were not able to completely cure the knee problem. So finally, again, the particular patient sued the hospital in the court. Again, the case was dismissed, saying that the hospital or the particular doctor has no his limitations. So since it's beyond his level of treatment or care, he advised the patient to go to a higher center where the particular facility or a particular specialist will be there. But in spite of all the advice given, the patient neglected. Hence, there was no compensation awarded to the hospital or to the patient. So these are some examples for contributory negligence. Number one, hiding relevant medical history despite being asked. The patient might be having some diabetes or maybe smoking or alcoholism. We might not have informed the doctor. Then it's a contributory negligence. Or refusing to take the suggested treatment, like in the mentioned previous case. So he's not taking that advice treatment, then it's a negligence. Whatever, maybe you are giving some antibiotic for 7 days, he'll be stopping in 3 days. Or you will be giving some aspirin or clopidogrel after a stenting, he will be stopping after 1 month. So this comes under contributory negligence. Then leaving the hospital against medical. So sometimes we call it DAMA, discharged against medical advice. If the patient is leaving the hospital against the doctor's advice, then again it comes under contributory negligence. Even if the patient suffers any injury or any complication, the doctor is not responsible or answerable. Not following any post-operative advice, skipping physiotherapy protocols, refusing ICU admissions when advised. Recently, there was a guideline from the Indian government. So ICU admission should be discussed with the patient. The patient is willing for ICU admission, then only the patient should be admitted. The patient is not willing, then the patient need not be admitted in ICU, but sometimes it may be double-edged sword. So proper documentation. So do not admit the patient in the ward. If the patient is having acute pulmonary edema or something like that, the patient might be coming and telling us, sir, I will put signature wherever you want, but I don't have enough money. So even something happens, even my father dies, I will not blame the hospital or any hospital management. So better keep the patient in ward. So actually the guideline says that if the patient is not willing to admit ICU, can be kept in ward, but still, again, we have to document it. Again, it's a contributing negligence from the patient side. So the patient needs proper continuous care from the doctors and nurses. He needs ICU admission. If he's refusing, then it's a contributing negligence. So it should be documented. Already I told you it's a very important legal defense. Any missed follow-up appointments, there's a document. If the patient does not follow your advice, returning after 20 days instead of 1 week. Our second one is incomplete antibiotic course. Record the instance where the patient failed to complete their prescribed course. Maybe some pyelonephritis or urosepsis, so you will be prescribing for 2 weeks. So he might be discontinuing antibiotic within 3 days or 5 days, something like that. In that case, the patient is again coming with fever and recurrent pyelonephritis, then you have to document it. The patient discontinued the medicine prematurely. Then third one is non-adherence to the medical advice. Note down the patient ignored dietary or physiotherapy recommendation, and finally self-medication. So sometimes the patient might be taking medication on his own for the initial 2 or 3 days. then the patient will be presenting with the complication. That also should be mentioned. So again, because we are not responsible for the complication that happened due to the patient's unethical act. So these are the 4 things we have to document whenever the patient is having a contributing negligence. And whenever the patient is discharged against medical advice or giving a discharge summary, these protocols should be followed. Few doctors, they actually don't give the discharge summary, especially in the medical colleges or government medical colleges. The patient is going against medical advice. They won't give any discharge summary. But it's a discharge summary is a legal document. It's a property of the patient. Even if the patient is not paying, they should be given discharge summary, saying that the patient is discharged against medical advice. We gave the particular treatment or these medications. So patient wanted discharge, hence we discharge the patient against medical advice. That should be mentioned and the discharge summary should be given to the patient. And discharge summary is a crucial document for legal defense. It should contain the hemodynamic instability. At the time of discharge, what was the patient vital? Then whether the patient is on inotropic support or not, how many liters of O2 was given or O2 support was needed or not, or whether the patient is on ventilator support while discharge, and how was the patient's conscious level and other things at the time of discharge. All these things should be mentioned in the discharge summary or the discharge against medical advice form. So it's also should contain the risks involved in the DAMA. So we have informed all the risks involved in discontinuing treatment and the risks of transport also explained. In spite of all the advice given, the patient or patient relatives are not willing to continue the treatment and they are willing to take the risk. Even the risk of death also informed. Still, the patient wants to discontinue the treatment. Hence, the patient was discharged against medical advice. This should be the mentioned in the case sheet, or you can have a separate form. So it's a DAMA form. There you can have a consent form like a separate printed out form you can have. So there the patient relatives has to sign and then take the patient out. So not providing or delaying a patient for providing a discharge summary or not giving any discharge summary when the patient is going against medical advice, then that may invite a suspicion that you have committed some crime or committed some mistake. That's why you are not giving any discharge summary or any documents to the patient. So this will be taken as a negative to the hospital or the doctor in the court of law. So even the patient is leaving against your medical advice or they are having some fight with the hospital and leaving, they don't want to continue the treatment there. Still the patient should be given a discharge summary and mentioning that the patient is discharged against medical advice after explaining all the risks involved in the treatment, discussing the treatment. And finally, this is a movie which came almost some 3 years back. This is available for the trial version of Amazon Prime online platform. So movie name is Vaida. So here this is a movie which I have seen the real description of the court proceedings. Actually, the story goes like that. The elderly man is sitting in the bottom of the poster. He's a coolie. He's some cobbler. He'll be doing his job by the roadside. He'll be hit by a two-wheeler rider. He got his lower limb fractured and later it was amputated. So they will be going for this third-party claim in the court. For compensation, they will be approaching the court for this compensation. So there will be argument between the two parties, by the patient defense, the patient public prosecution as well as the defense. Defense is from the insurance company, where the two-wheeler rider took the insurance, so that is third-party claim. So initially, the verdict will be going in favor of the particular patient, but later the judge will be changing and other judge will come. So finally, they will end up with the judgment going in favor of the insurance company, saying that why the patient sitting by the roadside and without getting any permission from the government is doing this gobbler job. So ultimately, the case will be dismissed. The inference is, so whatever thing we have done in the documentation or getting a consent or following all the legal norms, following medical ethics and etiquettes, whenever the case is filed against a particular doctor or a particular hospital, so we need a effective legal representation. That means you have to hire a lawyer who is effective or who is expert in the particular court. So there are few lawyers, like we are having a doctors like cardiologist or neurologist or orthopedician, something like that. They are specialists in the particular specialty. Likewise, so there are lawyers who are well versed in the criminal cases. They are criminal lawyers. They can win the cases only in the criminal court. They cannot win a case in the consumer forum. So better you hire a lawyer. If the case is filed in the consumer forum, so you consult a consumer forum expert. So there are few lawyers who are expert in challenging the constitution, like Kapil Sibal, something like that. They are not suitable for even they are charging some 1 crore or 2 crore for appearing in the front of the court, but they will be losing the case if they are appearing in the consumer forum. So you have to don't go for a famous lawyer. So don't judge a lawyer by the fees, how much he is charging, but you should be able to find a lawyer who is expert in the consumer forum, or the case is filed in civil case. You have to know the lawyer or find the lawyer who is expert in the managing the case in the civil court. So with this slide, I am just concluding. Actually, as per the court of law, so you should know everything. So ignorance is not an excuse. So you cannot go and tell the court that, sir, I don't know. So kindly excuse. In future, I will correct it. So this court never will accept. So you should know the law. You should know the all the acts. You have to abide by them. So if something goes wrong, we should have all the legal defenses in our hands. So you have to be very careful in the documentation and as well as communication to the patient. And finally, if there's something goes wrong, definitely go for effective legal representation to win the case. Thank you. So thank you. Thanks to Sendil Kumaran sir and as well as for API for giving me this opportunity. Thank you, sir.
Thank you, Saranan. Very complicated topic. You are taken in such a way, very interestingly and very informative. So any questions, anything you can fire? There is one question in the chat, Saranan.
Yes, sir.
For all poison cases, we are putting all MSC. Do you need to go to court?
Actually, sir, so as per Supreme Court guidelines 2011, if it is a suicide, it's not a punishable thing. But our Indian constitution has not changed. So if the patient sometimes commits suicide, it's against the constitution. It's a violence of our constitution. But recently, our parliament has also passed a law, passed a act directing ICMR for euthanasia. So that ICMR to frame some guidelines for patients who's having an incurable disease, whether they can be go for euthanasia or mercy killing. So ICMR is forming some guidelines nowadays. So if you are finding that the patient is 100% surviving, for example, he is consuming only 4 tablets of paracetamol or some 2 tablets of diazepam, then we are sure that the patient will survive. In that case, we need not inform the police or inform the court. But if the patient is very sick, is under the ventilator, and we don't know whether the patient will survive or not. So in that case, to be on the safer side, we don't know whether somebody has induced the patient to commit suicide. So that is the duty of the police to investigate whether it's suicidal or somebody has attempted homicide, something like that. So if you're not sure, better to give the police intimation. If you're sure enough, if it is 100% suicide, for example, it may be some loss of financial commitment, something like that. Purely the fault is with the patient, or he might be having some love failure, something like that. So there is no party involved. It's a pure the particular patient's involvement or commitment. Then and the 100% you are sure that the patient will survive. Then you need not involve. You need not inform the police. Otherwise, it's better to inform the police.
So as a treating doctor, we are not the investigating officer.
Yes,
So
sir.
it's our duty to inform when you are suspecting any foul play. Otherwise, you no need to torture. As per the new mental act, no need that all suicides has to be put as an MLC. What we are taught in our medical school during our periods, we need to put every poison case we have to file the MLC, but now it is not mandatory. Thank you, Saranan.
Sure.
Any other questions? feel free. An expert is there. So any legal issues, any
Sir,
medical legal
Sir,
question,
I have
you can
a
ask.
question. Can I ask, sir?
Yeah, please, ma'am.
Yeah, actually, sir, we stay in IIT campus, and so many people who are being treated in bigger hospitals, we know that okay, they have some end-stage diseases and they expire. Then we have to do home visit and give them. We have to certify those deaths. So that case, as I understood from the lecture, we are supposed to give Form 2, as you said. Am I correct, sir?
Yeah, if it is actually domiciliary death, the patient.
Yeah, it is domiciliary death because they are at their home. And when they expire, whenever there is no pulse or they are not breathing, they call us. And when we
Yeah.
reach the home, many a times we find they are not alive. Then there is some chemotherapy, some kind of treatment going on from a bigger hospital. So that time we are obliged to give them some, death certificate so that they can go ahead with the further proceedings. So normally what we do, we give on a plain paper, we say that we visited the home and the patient was not salvageable and CPR could not salvage the patient. So do you think instead of giving that, we should give Form 2?
Actually, Form 2 should be directly filled by the patient, ma'am. So actually, there is no compulsion for the doctor to give any certificate in any form. Sometimes it may be a homicide or it may be a murder.
Yeah,
So
yeah.
they want to shift the patient from their home to somewhere they want to bury. So for cheating the police, they will keep your certificate as a
Yeah.
evidence. Yeah.
So
So
what I
saying that,
have done, sir, I have myself prepared a document in which I take an undertaking from the relative or the near dear one that we do not have any obligation on IIT Delhi Hospital or the treating doctor, and the certificate was given on the basis of information given by the patient themselves.
no. So sometimes it may be 99.9% it may be genuine, but sometimes it may be a murder. So if you have not treated the patient, if you have not attended the patient, so don't give any certificate by following the patient
Just make
words.
them fill Form 2 and go.
Yeah, you can direct them to get the Form 2.
That is
Ma'am,
helpful, sir. They will get the
ma'am,
certificate from the registrar office, no, whether that certificate is produced,
Yeah,
given.
ma'am,
it's available online, ma'am. Also, they can get it
The-
from the municipal corporation.
Once they have that Form 2, no? Filled.
ma'am,
Yeah.
just follow the golden rule. If you are not treated the patient, certificate is issued. That is golden rule number 1.
G, sir.
Form 2 is for domiciliary death.
Yeah.
It is being given by the patient relatives,
Hmm.
immediate relatives.
Yes.
There is no role for doctor.
Yes,
If there
sir.
is an institutional death, it is Form 4.
Okay. Yeah,
If
that I
there is,
understood. So
yes, ma'am.
actually
Form
they
4A, Form 4A is for the death outside the institution. You give
yes, sir.
Form 4A. Now
And
I
you
am
For
coming
treated the
back to
patient
your
within 14
question.
days. Yeah.
Yeah,
if you are
I'm
not
coming back to your
suspecting it.
question.
Yes, sir.
I'm coming back to your question. There will be a social obligations will be there.
Yes,
They
sir.
will tell the doctor, they would have been known to you. They will say, sir, my old grandmother, 90
Yes, sir.
years, has
Yes,
passed
sir,
away.
definitely. Yes, sir.
So just to give a certificate like that. So as per rule, we should not give. So when the doctor certificate is not given, the municipal corporation birth and death register will not register. They will tell even for 95 years, they are asking the patient to relatives to go and get the doctor certificate. At the
Yes, sir.
time, you have to convince the person saying that, sir, as per the rule, I have not examined the patient. I have not treated the patient. But anyhow, I will help you out. I will talk to the birth and death register. You give Form 2. It is enough.
Enough.
Okay. So
Okay,
when you're
sir.
putting in a paper like undertaking and all, it will be a problem.
Okay, sir.
Or if the patient brings all the original records,
Yes,
okay,
sir.
they
Yes,
are
sir.
getting chemotherapy and other stuff and all, then
Mm.
we can write it and declare it the death. Otherwise, without knowing anything, please don't do it.
Okay, sir. Yes, sir. Thank you so much, sir. It was really very enlightening. I always used to get confused with this. I'm really
Thank
thankful.
you,
Thank you,
ma'am.
ma'am. Sir, one more question was in the chat box. Why was the referring orthopedician fined? Actually, orthopedician, just like that, he cannot refer from a GH, one thing. And second thing, if you want to send the patient to some hospital, he has to talk to the doctor there. Sir, I'm sending a particular patient. He's having this problem. So are you available there? So do you have the facility to receive the patient? All those things should be confirmed. Then only you can refer the patient to another hospital. So just give a filling of a form, and if you are referring, and in that particular hospital, particular treatment is not available, or if the particular doctor is not available, again it's a negligence from the doctor who referred the patient. So if patient is depending on you, so they are having full faith on you. So it is the doctor's duty to refer the patient to the particular hospital where all the facilities are available, and they cannot roam around here and there. So that's the reason why the orthopedician was fined. Then patient brought death, we can declare death even if we have not treated him right. Yeah, if a patient is brought dead, we can declare death, but don't give any declaration form. So if you are giving any death declaration form, that will be they'll be using it as a gate pass while crossing a checkpost. So traveling with the dead body is a crime. It's offense. You cannot travel with a dead body unless you have proper doctor certificate or a referral letter from the hospital. So when you're taking a treatment for higher treatment purpose, you are transporting the patient in the ambulance, then it is accepted. But in a car or somewhere, something like that, if you are transporting a patient, a dead body, it's offense. So don't give any form, any certificate. You have to actually retain the patient. Any patient brought dead, you have to retain the patient in your hospital. You have to inform the police. The police has to decide whether handing over the body to the patient relatives or the patient needs a postmortem. So you are not bound, or you are not obliged to give any certificate in any form. Even don't give any declaration certificate or a death declaration form. Nothing should be given.
Thank you, Saranan. If
Yes,
no more questions, we'll wind up for the day.
Thank you, sir. Thank
Any
you.
legal? You can ask him. Thank you.
Thank you, sir.
Thank you. Good
Thank
night.
you, sir.
Thank you.